issues that you were coming in for?
Yeah, mostly neck and shoulders.
Tightness, pain?
This maybe a month ago, my neck stiffened up.
Okay.
I couldn't go past maybe 45 degrees.
Okay, yeah.
Shoulders hurting every time any push exercises.
Yeah.
Maybe military press hurts.
Okay.
Now this one's hurting.
Okay.
This one, anything lateral raises.
Right. Do you remember any injury that occurred that started this process?
No, just slowly.
Just slowly kind of came about.
Happening.
Okay. All right. So I'm gonna do a little bit of palpation. Okay. On your neck and feel a couple of things, and we'll go from there. Okay.
Okay.
So have a seat right over here.
Cool.
Excuse me. All right. Let's see here. All right. So do you do a lot of upper back workout?
Yeah.
Yeah.
You say
okay.
moderate.
So give me your best posture. Okay. So definitely we have a lot of anterior roll here of the shoulders. Bring your shoulder. There you go, right there. So you definitely want to work on this here, okay? Because what I'm noticing is as you sit just normal, right? Mm-hmm. Your shoulders roll forward here, and I'm palpating. We do definitely have this. Do you feel like you're getting a little bit of a bump or a little like this pops out on you primarily? Not really.
No.
Never noticed it.
No,
okay.
I didn't notice.
All right, let's see here. Any pain or tenderness in here?
No.
No. Okay. What about right over here?
Yeah, that one, yeah.
Right there, yeah. Okay. And you don't remember an injury that caused that there?
Mm-mm.
No? Okay. All right. Okay.
Yeah, that one hurt a lot.
Right there, right? Yeah. Lift your arm to the side for me, and then don't let me push down. Hold it pretty tight. Any pain with that?
No.
No? Okay. Relax right there for me. Lift over here. Hold it right there. Don't let me push down. Any pain with that?
A little bit.
A little bit. Don't let me push down. Go. Any pain with that?
A little bit. Not too
not
bad.
Not a lot, but a little bit of tenderness.
Yeah.
Where would you feel the pain when we do that?
Maybe
in here?
Yeah.
Okay. All right. So ultimately, this could be a postural type issue, okay?
Okay.
We definitely, as I'm looking at your posture from the side, and as I was talking to you initially, I noticed your shoulders are rolled forward and how your head jots forward a little bit, okay? And so working on the rhomboids and on your intrinsic muscles, strengthening your intrinsic muscles will be helpful with correcting some of that posture, okay? Over time, that fatigue posture, working on as you're working out with that type of a postural presentation can definitely cause you to have this type of pain or tenderness, unexplained, kind of just woke up like that and progressively getting worse, okay? So what we're gonna do from a treatment standpoint here, we're using electronic stimulation, some hot packs, a little bit of a little bit of soft tissue therapy, chiropractic adjustment, okay, some stretches on a vibration plate, okay? And then for at home, I definitely recommend a postural exercise type of system, okay? So I'll have my staff show you one so you have a general idea of what we're talking about, okay?
Okay.
All right, so if you can, lay face down right here, we'll get started with the treatment here, okay? So we're gonna demonstrate a couple of treatment, like a session that we do here at the clinic, and we're dealing here, we have the, where you have the kyphosis right over here, the hyperkyphosis here in the upper back, which means that it's kind of like your back is a little curved, right? Okay, and many times I'll see this in the clinic, and that can be addressed through chiropractic adjustments. Many times you'll see this drop down immediately after an adjustment, okay? And we'll definitely see how it's more hypertonic on this side. So in other words, the muscle is tighter on that side. You'll see the difference here, okay? See, note the difference between this side and this side. Okay, so hypertonic means that it's going to be tighter, right? There's more of a spasm or contraction right over here versus this side. You may or may not be able to depict that on camera, but I definitely see it here, okay? Do you feel tighter muscle into here versus here?
Yeah, I feel it more on the left.
More here on the left, okay. Okay. Okay, and I can feel all the knots, right, as we've addressed on different videos what I mean by the term knots, right?
Yeah.
Trigger points here. You saw that response, right, Jason? He gives me a thumbs up. Okay, so I'm going to use some electrodes primarily right over here to try to help micro massage this area here, okay? Relax right there for me. Okay, have you had this kind of therapy before?
No, first time.
All right. Let's see here. So have you heard of physical therapy modalities, chiropractic adjustments, stuff like that?
Nope.
No. Okay. So some of the physical therapy modalities we're going to be using, right? Like electronic stimulation is a therapeutic modality. Modality meaning like it's a type of treatment, right? And so we use electrodes to create a micro massage, increase some circulation there, try to help reduce that local spasm here. Okay. And you can note it. Now it's hard to tell the difference between this side and this side, but you can definitely see that. You note a lot more difference there. So you would strongly benefit from deep tissue massage here as well. Okay. I'm gonna be primarily on one side, okay? And we're gonna try to micro massage this side first here with the machine there, okay?
Alright.
Alright, so we use that. We're gonna try to get to a point where you feel a nice deep movement. You feel that?
Yeah.
Okay. So I don't want it to be painful, but I do want you to feel it for the full time, okay? Is that causing pain?
No, but I feel it.
Does it feel good? Does it feel bad? Does it feel okay?
Yeah, it feels pretty good.
Feels pretty good there, okay? So we're gonna try to. So what one of the positives or one of the goals with STEM, also with creating circulation, lymphatic drainage, is to remove pain, right? Stop the pain receptors from firing. So a lot of patients say it feels good. Feels like the pain is not there when you apply the stem, right? And so that's what you're feeling right now? Feeling pretty good there?
Yep.
All right. So we want to put a couple of hot packs here on you. Okay. We'll put one right here. We'll put one right here. We're going to let that run for about 10 minutes, okay? Once that's done, we're going to get into the adjustment part of the visit, and we'll continue accordingly.
All right.
All right, we're back here shortly. Hey guys, so we're back here with Mario again. We set up the electrodes, right, on that left side where we were noticing some hypertonicity, right? And so as we were, chatting about different things, he was telling me that he carries glass. He works for a glass company for a living, right?
Yep.
And so he loads a truck daily. Sometimes he'll have glass that's as big as this wall or the wall behind me, as you can see. And so he's loading and primarily stabilizing with that left arm, right?
Yeah.
And so stabilize with the left arm, and so in essence, it's very likely contributed to that hypertonic position on the left side here. Okay. So at home, doing some intrinsic exercises to strengthen or to correct that posture can definitely help with this. Okay. Somebody like that, and as I discuss with my patients daily, look, you're not going to change your job, right? It's what you do for a living. What your job requires is for you to load or unload, or in my situation, adjust bodies to a different style, different techniques. So these are going to be body compensations that happen because of the job duty, right? Because of the job responsibility. So what do you got to do? You've got to come in for treatment, get massages, get chiropractic adjustments, do some therapy, take care of yourself so that you don't end up having a kyphotic spine that ends up becoming degenerative in a kyphotic position. Then you become that old person who's walking like this and can't look up because your neck won't. You're just like that, right? Like we were talking that hyperkyphotic position here, right? So over time, this can definitely lead to that. Right now, he's pretty young, right? So we can correct some of this issue now, and he can be aware of how to prevent this from getting worse. Okay. So we're gonna start with some neck adjustments here, guys. You feel all that into that side still, and you definitely feel that hypertonicity or that tightness in here, right? And that's where over here it's tight, and over here we kind of have more into the neck. So we're gonna perform an adjustment here first. Okay, relax your body. I want you to just lean your head this way for me. There you go. Good. Okay. I don't know if we've done the seated neck adjustments on video for a bit, but it's pretty fun, right?
Yeah.
All right.
You could hear that?
Yeah. Oh yeah. All right. Not only can you hear it on video, but I can feel it through my hands. Feel the movement. Yeah. There you go. Good. Okay. All right. Okay. How'd that feel there?
Yeah.
Pretty
Felt good.
All right. Let's have you lay face down right here on this adjusting table. Okay. So lay face down right there for me. Okay. And I'm gonna use a little bit of like a healing lotion right up here. Okay.
All right.
All right. So let's get right in here. Okay. After the adjustment, we're gonna try to see some post-adjustment or post-therapy changes on that area. Okay. I'm not saying it's gonna go away, but you know, at least we know we're working the area of issue. So when he came in, he was talking about neck pain, right?
Yep.
And all of a sudden, here we are talking about a whole bunch of postural type issues, spasmic muscle here, spasm into the neck, and here we are. Take a deep breath. Completely exhale. There you go. Good. Okay. Right in here. Take a deep breath. All the way out. Good. Take a deep breath. All the way out. There you go. Good. Feel that one?
Yeah.
All right. Relax right in here. Good. Relax here. Good. Okay. Lay on your side facing this way for me. Rest your head right in the center right there. Go top leg bent, bottom leg straight. So bend this knee right there. Give me this arm right over here. Rest your head right in the center, right there. Okay. Put your arm like this. Go right in here. Take a deep breath. All the way out. There you go. Lay facing the opposite way for me. Same thing right here. Go top leg bent, bottom leg straight. Right there. Right in there. Okay. Good. Right over here. Okay. Scoot your body forward a little bit for me. Good. Okay. Breathe in. Completely exhale. There you go. Lay on your back face up for me. Okay. And do a traction adjustment here. Okay. Relax here. Good. Okay. Let's have you lay face down. And let's check that back. Okay. Good. Okay. Here. Okay, good, perfect. Okay, and I'm still gonna see that hypertonicity here. I could definitely still see it, but it's definitely more left-sided than right. Okay. All right, and I'll definitely look at the video later, right, to compare pre and post, right? But definitely, we do you feel it pretty tender there?
Yep.
Yep. Okay. Right in here.
Yeah.
Yeah. Right in here. Not as
so
bad.
much.
Okay. And it's swollen. Okay. You could definitely feel see the difference. The edema built up there.
Yeah, I definitely feel that one.
Yep. All of these trigger points up and around the scapula or periscapular trigger points here. Okay, and so it's not 100% better, but it is better. Okay, from what we saw at the beginning to now, we see some improvement. This type of scenario here, situation here, you can stand up here. This type of situation here would probably require some sort of plan of action, right? At our clinics, we don't do like a plan of action where it's like, 52 visits and we're gonna get you better. This is more, look, do some postural exercise at home. On a come-as-you-need basis, I would say maybe once a week for a few weeks and see how your body responds. What are the appropriate types of therapies for this? Adjustments, soft tissue work, massage, deep tissue massage, stuff like that. Postural exercises. How do you feel overall?
Feel great.
Feel great?
Yeah.
Let the camera know you feel amazing.
Feel awesome.
And we'll see you guys soon. All right, brother.
Thanks, man.